Hi there. Thank you for joining us. And thank you to KSB Wellness for hosting us. My name is Gabe Billiet, PharmD, and joining me today is Luke Herbert, PharmD. And today we're going to talk about monoclonal antibodies for COVID-19. All right, Luke, what can you tell us about monoclonal antibodies? What are they?
Sure. So antibodies are one of your immune systems and your body's primary defenses against infection. So when somebody's exposed to COVID, part of the immune response to fight the virus is production of antibodies. The monoclonal antibodies that we're talking about today are actually made in a lab, and they're specifically designed to identify and fight virus, COVID-19 virus. So these were first made available late last year, early this year, and they've been used throughout this year to give to patients, as we'll explain, who have been exposed or have COVID.
Okay. So basically what you're saying that just kind of jump starts the body's immune system to help kind of treat the illness. When do we use the monoclonal antibodies?
So the antibodies are used for somebody who's already has a positive COVID test. So in somebody that's still at home with mild to moderate COVID, so somebody that's not yet severe enough to be hospitalized. And you may feel pretty sick. You may have a lot of aches and pains, maybe fever, but you're not short of breath such as you need to come to the hospital and be treated in the hospital. Okay. So the patient's symptoms may vary quite a bit, but yeah, prior to hospitalization. And it's also specifically for patients who are at higher risk for severe disease. So we'll look at some criteria here. And the other important aspect of the antibodies is where they're effective in the first 7 to 10 days after symptom onset. So beyond 10 days for sure, they're not known to be effective or helpful. So we want to provide that infusion ideally within the first 7 days of symptom onset.
Okay. Who would be our target kind of group for this? Who's our higher risk patient population that we're looking at that could benefit from this therapy?
Sure. So the criteria on the screen here, patients over 64 years of age, so 65 and older, patients that have a higher than ideal body weight, so are a little bit moderately to highly overweight, patients that are pregnant or have other chronic health conditions such as chronic kidney disease, diabetes, heart disease, or chronic lung disease, and also patients with immunosuppressive disorders. So all of those patients we know, depending on the severity of the criteria, but those patients may on average have a 10 to even 15% chance of hospitalization, and the antibodies can decrease, if given in a timely manner, can decrease the incidence of hospitalization by up to 70%.
Wow, that's quite the reduction. Well, my next question was going to be why consider monoclonal antibody therapy, but you did definitely touch on that, about that reduction of risk of hospitalization and the illness progressing. Do you have anything more to add to that about why we should consider this monoclonal antibody therapy?
Yeah, it's really just to decrease severe COVID disease and the outcomes of that in hospitalization. And it's important to understand that you certainly don't want to wait until you're very sick to decide to get the antibodies. At that point, it's probably too late. So it's really more about using those risk factors that we talked about, and assessing the risk of you progressing to severe COVID and hospitalization based on those risk factors, and then getting the antibody infusion prior to becoming more sick.
Okay. Well, how would a person go about getting treatment?
So definitely, first you want to reach out to your provider, one way or another, get a test for COVID-19, make sure that that's what's happening. And then your provider may be contacting you to let you know that you have a positive test. Or if you have a positive test, maybe a home test, you should reach out to your provider and let them know you've got a positive COVID test. And, you can ask them at that point, especially if you have some of those criteria, over 65, diabetic, higher body weight, any of those criteria, you can ask about antibodies to prevent severe COVID at that point.
Okay. Now, if my doctor suggests it, and I meet the criteria, where would I be able to get an infusion for this or treated for this?
Sure. So in the Dixon area, in our area here, we provide the infusions in our outpatient infusion department, and that would be arranged through an order from your provider. So certainly reach out to your provider or a KSB provider, and then we've got an order form and a process that they can utilize to arrange the infusion. So once you have that conversation with the provider and you and your provider agree that it's appropriate, they'll forward a order form to the pharmacy department, and then the infusion services will reach out and set up an infusion time.
Okay. Now, I know that a lot of folks are concerned about side effects of medications. We talked a little bit about side effects in a different presentation, but what could people expect with this treatment?
Yeah, most folks tolerate it pretty well, honestly. And I should mention antibody infusions aren't a completely new thing. So we use antibodies to treat things like, as you know, Gabe, rabies exposure, rabies infection, or tetanus sometimes in certain cases, and other things. So these antibodies are specific to COVID. But most people tolerate it pretty well. That you can always have an allergic reaction with something like this. It's been pretty rare. Serious allergic reactions have been quite rare with monoclonal antibodies. Infusion reactions can occur during the infusion, and those are usually pretty easily treated by the nurse slowing down the infusion or pausing the infusion, and then continuing as needed.
Okay. I know that we've used monoclonal antibody treatments in cancer for decades even, so but how well do these monoclonal antibodies work in treating COVID?
So about 75% reduction in hospitalization, and I think the early studies, the patients that were looked at that had the criteria that we spoke of earlier, again, the risk factors, their incidence of hospitalization was around 9 to 16%, and antibody infusions in a timely manner decrease those hospitalization rates down to 3 or 4%. So about a 70% reduction. So I think if we put that, the antibodies certainly don't replace vaccination. And we know that the vaccines for COVID worked really well against preventing severe COVID and hospitalization. We aren't, seeing people hospitalized really that have been vaccinated. Most of the folks that are being hospitalized for COVID right now have not been vaccinated. But if for some reason you haven't been vaccinated and you do become positive, a 70% reduction in the risk of hospitalization is a really good outcome for sure. And it's much better than any of the therapies we can offer you once you're severely sick and actually hospitalized with COVID.
Right. Okay. Now, if a patient was to receive the infusion, what's kind of the next steps, after they get the infusion, or what should they know after that?
Yeah, really after that, everything's the same. I think it's good to know that it's not something that's going to make you, feel markedly better right away. Again, the intent is to decrease the infection from progressing to severe COVID. So you're going to go back home. You're going to continue to isolate. You still have COVID disease, so you need to follow the isolation guidelines and so forth, and treat yourself with Tylenol or ibuprofen as you normally would. And if you do progress to any shortness of breath or anything like that, you would still reach out to your provider. Or shortness of breath, you would certainly come to the emergency room.
Okay. What about vaccinations? I've gotten that question from a few different patients. Can they get vaccinated after they get the antibody treatment?
Yeah, you can still get vaccinated. They do recommend to wait 90 days after the antibodies before you get vaccinated, and the antibodies do stay in your system for quite a while. But you still can get vaccinated. There's really, if you have COVID, so patients that get the antibodies, obviously have COVID, there's not really any urgency to get vaccinated at that point. So around 90 days would be a good time post-COVID infection to consider vaccination as well.
Does it matter if a patient's been vaccinated? If they come down with COVID, does it really matter if they've been vaccinated or not vaccinated if they're positive for COVID?
In general, we don't treat vaccinated patients once they have COVID, much differently. Although
Okay.
the caveat would be, so the short answer is, if you're vaccinated, can you still receive antibodies? Yes, you can.
Okay.
But that being said, as we said earlier, vaccinated folks have a pretty low risk of severe COVID and hospitalization. So for the most part, antibodies may not be necessary or make sense in somebody who's been vaccinated. I would say an exception to that would be folks that maybe are immunocompromised, because we know that the vaccines may not work as well in somebody who's immunocompromised,
Okay.
or somebody who has extensive risk factors. So maybe upper 80s, and maybe overweight and also diabetic. They have a lot of
Okay.
risk factors for severe COVID. It could still make sense to do an antibody infusion in a patient like that.
Okay. So basically, anybody that's at risk of being hospitalized from it, regardless, would probably benefit from it. So if they
Correct.
have that risk factor. Okay. Another thing that I know I've gotten questions about is, how expensive, with this treatment. New things tend to cost a lot in the healthcare world.
Yeah, for sure. And so, one of the things I think when we're talking about COVID is, Gabe, we need to kind of footnote that right today is September 16th, and things change almost daily, with this. So we started having this conversation about a week or so ago, when we recognized that we were probably underutilizing the availability of antibodies in COVID
Mm-hmm.
patients. And in that short time, we've realized and found out that the availability of antibodies is they're not as readily available as they were, and so the states are starting to allocate supply. But that being said, up to this point, we've been able to get antibodies that have been provided and paid for by the U.S. government. So there's no cost at this point in time for the
Oh, okay.
antibodies for infusion. There may be some cost for the cost of the nurse doing the infusion and the infusion time, but
Okay.
the antibodies, which I think when they're on the market and we're buying them to provide, I think they will be, as you said, quite costly. But at this point, it's zero cost for the antibodies.
Okay. All right. Well, good to know. So basically, in summary, what I've heard you say is, if you test positive for COVID and you have the risk factors, they'd be a good candidate for it. Do you want to kind of summarize and kind of circle back to some of your big points from talk today?
Sure. Yeah, and I think yeah, thank you. And I think if you've tested positive for COVID, you want to reach out to your provider for direction on taking care of yourself. And if you have some of those risk factors, if you have chronic health conditions, if you're over 64 years of age, or if you're moderately overweight or more heavily overweight, any of those risk factors, I would definitely recommend that you talk to your provider about the antibodies, and absolutely don't wait until your symptoms escalate. We want to try to do that antibody infusion within 7 days is when we know it's the most effective. And so
Okay.
by the time you start to have symptoms and go through those steps, you can get to 7 days pretty quickly.
Definitely. So, all right. Well, you've given us a lot of information, a lot of good stuff to think about. I appreciate you joining me today, and I appreciate, like I said, KSB Wellness for hosting us, for this talk. If any of our patients in the community have any kind of questions, please drop them in the comments below, and we'll answer them to the best of our ability. All right.
Absolutely. Thank you, Gabe. Thank you.
All right. Take care and have a safe day, everybody.